We live in a changing world in which emergency response personnel must be prepared to deal with an ever-increasing variety of incidents. Responding to hazardous materials accidents is a special challenge for emergency response personnel. Safety of both the public and response personnel depends on planning, training, and practice. Radioactive material is one class of hazardous material, and response to an accident involving radioactive material is similar to other hazardous material accidents. Radioactive material can be found in small amounts in smoke detectors, in homes, institutions, and offices. Although the use of radioactive material has increased in recent years, accidents involving these materials are rare. Radiation accidents can occur in industrial plants, construction sites, nuclear power plants, university laboratories, hospitals, and during the transportation of radioactive material. For the most part, radioactive material is safely used and transported by a wide variety of vehicles throughout our towns, cities, and rural areas every day, equaling approximately 3 million shipments a year. As a responder, you encounter many kinds of emergencies entailing varying degrees of risk. All emergency situations are potentially dangerous, and some may be complicated by the presence of hazardous material. When you suspect that radioactive material may be present at an accident site, take appropriate actions in accordance with your level of training and local procedures to protect people and the environment. The Emergency Response Guidebook, or ERG, states that medical problems should take priority over radiological concerns at a radioactive material incident. While the hazards associated with radioactive material should be respected, knowledge of simple protective actions will allow you to safely administer emergency medical care and perform victim rescue. The basic protection principles of time, distance, and shielding are useful in minimizing radiation exposure. Your goal is to stabilize and rescue the accident victims using these protective actions to reduce radiation exposure levels and to prevent the spread of radioactive materials on the victim, yourself, and in the environment. This video will demonstrate basic response techniques to a transportation accident involving radioactive material. The video will show responders' arrival, size-up, initial response actions, scene entry, victim rescue and treatment, decontamination techniques, and transport to medical facilities.
Engine 1, Engine 51, Hazmat 51, Medic 2, respond to Mesquite Road, mile marker 2. We have a report of a multi-vehicle accident.
The techniques demonstrated in this video are generic in nature and are in no way intended to replace your local response procedures.
Already on scene. Further information provided by arriving units. Timeout 11:30 hours.
Arriving emergency responders position their vehicles a safe distance upwind of the accident area. The initial scene assessment takes place at this point in the response process. A useful acronym to use and remember throughout the response is SIN. SIN stands for Safety, Isolation, and Notification. Safety of response personnel is always the first operational thought. Responders approach the scene from upwind and upslope, using binoculars to identify the hazard from as far away as possible. A visual survey of the accident scene is made to determine if hazards such as fire, leaks, spills, or other hazardous cargo exists. In this case, radioactive material has been identified from markings and labels on packages at the scene. Once all hazards have been identified, use the ERG to determine initial response actions and isolation distances. Bystanders and ambulatory patients in the immediate hazard area are moved to a safe area and asked to remain there until they can be surveyed for contamination. The incident commander will determine tactical priorities. In many cases, multiple activities may occur at the same time. Firefighters wear structural firefighters' protective clothing, and EMS personnel wear their standard Universal Precautions protective clothing. As with all hazardous materials incidents, respiratory protection should be worn inside the hot zone until it is determined there is no respiratory hazard. Responders should take only necessary equipment into the hot zone to minimize contamination of equipment.
When you get out, all right? Be careful, we'll have decon set up when you come out.
All response operations are coordinated through the incident commander.
On air. Careful.
Large, complex events where multiple agencies respond may require a unified command structure. The initial focus of the command post will be taking those actions needed to protect the public and response personnel. As with any hazardous material event, the incident commander has assigned positions within the incident command structure based upon the nature of the event and the availability of personnel. Accident victims are treated based on their injuries. Remember that medical treatment takes priority over radiological concerns. Use your best judgment, but do not delay life-saving care. To properly prepare the victim for removal from the hot zone, a backboard wrapped in 2 blankets is brought to the victim. The outer blanket is spread out on the ground, while the inner blanket is used to wrap the patient once placed on the backboard. As with any accident, the airway, breathing, and circulation of the victim are immediately assessed. Non-ambulatory victims are provided life-saving care and are prepared for removal from the hot zone. Precautions are taken for possible neck and back injuries. Radiation exposure will not cause immediate visible signs of injury. Therefore, any symptoms observed are from something other than radiation. The presence of radiation or contamination will not affect the operation of equipment. If victims are ambulatory, they are assisted out of the hazard area and decontamination decisions are based on the nature of their injuries. While EMS personnel perform rescue activities, fire personnel extinguish fires and work to recover the shipping papers.
Got the shipping papers in hand. We're on the way out.
As a precaution, shipping papers are placed in plastic bags for contamination control. The shipping papers remain at the command post so that the radiation authority and emergency response personnel can have ready access to the valuable information contained on the shipping papers. Information found on shipping papers includes the material's proper shipping name, hazard class, and UNID number, emergency contact number, shipper and receiver name and address, total number of packages, the identity of each material radionuclide, such as thallium-201, technetium-99, and iodine-123, the physical and chemical form of each material, the activity contained in each package, category of label applied to each package, and the transport index for each package. Control boundaries are established based on guidance from the ERG. Normally, 2 control lines, both extending 360 degrees, are set up at the accident site. An inner control line marking the boundary between the hot zone and the warm zone. The hot zone, also known as the exclusion zone, should only be large enough to conduct response operations and control the spread of contamination. Radiation readings at the hot zone boundary should not exceed 2 millirem per hour. The outer control line separating the warm zone from the cold zone is established where radiation readings are at natural background levels. The decontamination corridor is contained within the warm zone. Both personnel and equipment are surveyed prior to being released from the warm zone. The incident command post is in the cold zone, a safe distance away, upwind and upslope from the hazard area. Law enforcement personnel provide a critical response role. Typical duties at a hazardous materials scene usually include protecting the public by keeping them away from the hazardous area, protection of response personnel by establishing and maintaining physical security at the incident scene, providing expert advice to other response personnel on evidence preservation, and performing accident investigation. As soon as response personnel determine there are potentially contaminated accident victims, the command post notifies the hospital that a contaminated victim is to be transported and identifies the radioactive materials stated on the shipping papers.
Chief Alverson, I'm out here on Mesquite, and I've got a traffic accident with radiological material.
The hospital will need time to prepare their staff and facility. The identity of the radioactive material can aid in the medical decontamination decisions. Life-threatening injuries have priority over radiological assessment. Clothing is removed so that injuries can be fully assessed and to remove as much contamination as possible. When the victim is ready to be moved, and if time permits, field decontamination of the victim is limited to the removal of their outer clothing. This is referred to as gross decontamination. Once the victim is placed on the backboard, the inner blanket is used to wrap the patient, and the outer blanket is left on the ground. This is referred to as the double blanket method and is used to minimize the spread of radiological contamination. The victim is then moved to the control line. Time permitting, the ambulance interior can be protected from radiological contamination by taking a few simple steps. Establish ready access to needed treatment equipment. Close all compartment doors. Stow equipment and items not needed. Wrap equipment in plastic and set up bags for disposal of contaminated items. The victim is brought to the control line where an ambulance stretcher has been prepared for packaging the victim. The victim is wrapped in another blanket to minimize the spread of contamination. Ambulance personnel should wear standard universal precautions protective clothing and face masks. If available, the victim is transported by an ambulance crew that has not been in the controlled area. En route to the hospital, additional information is relayed regarding the number of patients, their condition and medical status, and estimated time of arrival.
Desert View, this is Medic 2. We're en route to your facility. A 45-year-old male is involved in a motor vehicle accident.
If known, the extent of contamination and any suspicion of internal contamination may be relayed. The ambulance crew should also ask if there is a designated entrance to the hospital's emergency department for contaminated personnel. Care should be taken to minimize the spread of contamination. This can be done by changing gloves frequently, bagging discarded gloves and clothing, not opening unnecessary compartments, and by using portable kits. Once all emergency actions have been completed, responders who are in the hot zone follow a set protocol. In this case, the local hazardous material response team assists in an accident involving radioactive material. Specially trained personnel arrive at the scene and begins assisting responders in surveying and releasing personnel from the controlled area. Bunker gear, respiratory protection, and any equipment used is removed and left inside the hot zone. These personnel have knowledge, skills, and equipment that can be used to characterize and control the hazards posed by the radioactive material. In addition, this team has training in the various methods for decontamination if needed. Because radiological contamination is suspected, responders are surveyed by trained personnel. If trained personnel are not available, responders should consult with their jurisdictional radiation authority for further instructions. The radiation authority should always be consulted in any accident involving radioactive material. The radiation authority may have additional resources for assisting in the response effort. The team documents the extent and location of contamination. In this case, since radioactive material is the only hazard, only localized decontamination would be performed if contamination were to be detected. If multiple hazardous materials were present, the traditional decontamination method using an appropriate wash solution would be recommended. Once protective clothing has been removed and responders have been surveyed, they move to a designated location for post-incident assessment and evaluation. Upon arrival at the hospital, the ambulance is met outside the emergency entrance by hospital staff. Patients will again be evaluated at this point and be admitted for emergency care. The usual medical report is given, as well as information regarding the radiological status if known. Unless needed back at the accident site, the ambulance crew bags contaminated items, secures the ambulance stretcher and transport vehicle, and do not leave the controlled area. To prevent the possibility of internal contamination, they do not eat, drink, smoke, or chew. The ambulance crew and their equipment return to regular service only after they have been surveyed and decontaminated if necessary. Responding to hazardous materials accidents is a special challenge requiring planning, training, and practice. The safety of both the public and response personnel may depend on your knowledge and actions. Remember these points. The procedures involved in emergency rescue and transport of accident victims are very similar to those used for fire rescue or where hazardous materials are involved. Set up control lines and establish a command post upwind and upslope of the accident area. Perform rescue and life-saving treatment as soon as possible. Spend as little time as possible in the hazardous area. Stay as far as practical from heat, flames, toxic chemicals, or radioactive material. Necessary emergency medical treatment should not be delayed by attempts to measure levels of radioactivity. Wear the appropriate level of protective clothing. Use time, distance, and shielding techniques. Do not eat, drink, smoke, or chew anything while on scene. Simple isolation precautions and contamination control techniques can prevent the spread of radioactive material. At the hospital, the usual medical report of victims is given, as well as information regarding the radiological status if known. By employing these procedures, emergency response personnel can adequately prepare to care for the needs of accident victims while affording maximum protection to themselves and victims alike.